Bispirasol. Cotipride.
Hello, dear Tawas audience. First of all, I would like to thank you all for your interest in our Ramadan webinar series, for your loyalty, trust, and commitment. I would also like to thank our dear sponsors and partners for their support. It is my great honor today to present this interesting webinar titled Osseodensification in Sinus Lift, which will be led by our dear Dr. Angello Cardarelli. He is graduated in dentistry and prosthodontics at the University of L'Aquila in 2007, specialized in oral surgery at Université Sapienza of Rome in 2010. He is assistant professor and tutor at the San Raffaele University of Milan. He is scientific advisor of the dental clinic of the Department of IRCCS San Raffaele of Milan. He is scientific advisor of the International University of Universiapolis. He is also a member of the Global Scientific Dental Alliance in Dubai, Milan, and Isernia. He is the author of numerous publications, speaker at international congresses of implantology and oral surgery, and the list, of course, goes on. We are also honored to have with us today Professor Jean-Marc Derceau as our moderator. He's a former president of the French Society of Periodontology and Oral Implantology, former representative of France in the European Federation of Periodontology, former assistant professor, University of Dentistry, Paris 5, visiting professor at Paris Cité University of Dentistry, international member of the American Academy of Periodontology, expert witness for Paris Court of Appeal, associate member of the National Academy of Dental Surgery, practice limited to periodontology and oral and implant surgery. He has published 68 articles in various journals in French and English, about 420 lectures in different countries, and the list is even longer. So I'm going to hand over to our moderator, Jean-Marc. You can start your intervention. The floor is yours.
Okay, thank you. My introduction will be very short because we are in a little delay. So, of course, it's a great pleasure for me to be with you. The huge welcoming from Tawassul Group, and I want immediately to give the audience to our lecturer, Dr. Angello Cardarelli, please.
Thank you, dear doctor, and thank you, everyone. Thanks for your time, and sorry for this little bit delay. I had some technical problem, but everything now it's going well. So, hello, everyone. Marhaba to all my Arabic friends in Morocco and around the world. It's a great pleasure for me to be here today with the Tawassul Dentist Group, and thanks again also Dr. Kamal Benansur for having me today during this interesting event for our friends, for our doctors. Today I'm going to share this interesting topic regarding the treatment of atrophic maxilla using a new approach. As you know, sometimes we need to treat the posterior side of the maxilla, and we have a different possibility in order to treat these sides. Crestal sinus lift, lateral sinus lift approach, using short implants, using tilted implants. And today, we will see together the new approach, maintaining the same result, the same stability in terms of the osseointegration, and also reducing the morbidity and the invasivity for our patient. Because sometimes we need to treat a patient with some systemic disease, some healthy problem. So in those cases, it's better to follow a minimal invasive approach, maintaining the same result in terms of the aesthetic, in terms of the function, in terms of the predictability of our treatment for our patient. Introducing this new concept, using a dedicated bars in order to perform the osseodensification procedure. So with the osseodensification approach, we will move the bone. We can expand the bone in horizontal and in vertical dimension. So today, we will talk about the use of this approach in the sinus augmentation. But with this approach, we can treat many cases in terms of the bone expansion, in terms of the immediate implant placement in the molar area, expanding the bone septum. So this is a very interesting approach. So using this kind of procedure, we can treat any ridge, any implant, and any jaws. According to the shape of these bands, we can use these bands in the counterclockwise direction in order to perform the osseodensification procedure. But for sure, at the same time, we can use these bars, as we know, like the traditional approach, using these bars in clockwise direction. But in order to perform this kind of osseodensification, we need to use these bars in counterclockwise direction. So we can treat the sinus elevation like this. We can expand the bone in terms of the horizontal direction. And also we can perform the guided expansion graft using two stages. But today we will talk about the sinus lift augmentation using the crystal approach and using the osseodensification bars. So, according to this procedure, we can treat different clinical cases. As I told before, subcrestal sinus lift, ridge expansion, immediate implant placement in the molar area. Because as you know, inside the bone we have the collagen. So through the collagen we can have this plasticity of the bone. And through the bone plasticity, we can move the bone. Don't cutting the bone, but moving the bone. This is the new concept and the new approach. And also preserving the buccal bone, we can reduce the healing time, we can increase the bone stability, and we can have a good support for the soft tissue on the buccal bone side. And also during this procedure, in the counterclockwise direction, we can reduce the micro movement. And reducing the micro movement, we can increase the primary stability. As you can see, and increasing the primary stability, we can reduce the healing time and we can increase the bone healing. Don't forget this concept. And have a look at this image. In this picture, we can see the implant sites preparation using the osseodensification bands. As you can see here, we can see the bone around the implant site preparation in the both sides through the bone plasticity. Thanks the collagen that we can find inside the bone. This is an interesting concept. So have a look. So using these bars, we can have this very precise preparation, preserving the bone. And inside the implant site, we can see the bone. And with this bone, we can reduce the micro movement, we can increase the primary stability. And according to the quality of the bone, we can reduce the surgical steps. For example, here, in order to place 4.2 implant in terms of the diameter, we can use only 3 drills. The pilot drill in clockwise direction, the next drill 2.3 in the counterclockwise direction, and the last drill, it will be 3.3 in order to place 4.2. Only 3 drills. But for sure, and I will explain better during this lecture, we need to change our protocol according to the quality of the bone, according to the shape of the bone, according to the surgical site that we need to treat. I mean, maxilla or mandible. So, have a look. As I told before, those are the bars that we need to use in order to perform this kind of implant site preparation. And we can use these bars in clockwise direction according to the traditional preparation, the traditional technique. But have a look. In order to perform the osseodensification, we need to change the direction using the counterclockwise direction, moving the bone, don't cutting the bone. And after that, according to the quality of the bone, we can place the implant. So, for example, sometimes we need to use the pilot drill to fix the final lens, and we will use this drill in clockwise direction. After that, with the next drills, we will use the opposite direction, I mean the counterclockwise direction, in order to expand, in order to move the bone. Don't forget this concept. It's very important in order to understand this procedure. So as I told before, inside the bone we have the collagen, so we can use the bone plasticity to use this procedure, okay? And as I told before, we have histological evidence, clinical evidence, and we can treat different clinical cases. But today we will discuss about how we can manage the sinus lift augmentation using the crystal approach, also in extreme case, also if we have only 3 millimeters of residual bone, using only one surgery, only 3 drills, minimal invasive procedure, one step, reducing the healing time, increasing the healing bone, reducing the morbidity for our patients. Don't forget this concept. As you know, according to the quality of the maxilla, in the anterior side of the maxilla, we have the D1 bone, very high density bone. We have the cortical bone in this area. In the posterior area, according to the quality of the bone and according to the presence of the sinus cavity, after the tooth extraction, for example, we will have an important hyperprimatization of the sinus cavity. So, for this reason, we need to treat this area, increasing the bone height. And as you know, the lateral sinus lift is a predictable therapy. We can, as you can see from this clinical case, we can open the lateral window and we can see on the right the integrity of the sinus membrane. So, as you know, the integrity of the sinus membrane is always mandatory. And this is the traditional approach with the lateral window. So, it's a predictable therapy. But now we can upload our approach, introducing this osseodensification crystal approach using the denser bars. And have a look at this case, just to understand how we can treat this case. We are here in the maxilla, in the right side of the maxilla, so we need to place one implant here and one implant in the posterior side. And have a look here, the amount of residual bone that we can have below the sinus cavity, only a few millimeters. So I want to increase this bone height using this procedure, using the osseodensification procedure. So as I told before, in this case, considering that I have at least 3 millimeters below the sinus cavity, I can start the implant site preparation using the first drill, the pilot drill, 1 millimeter below the sinus cavity, in clockwise direction. Have a look. Like this. Okay? Pilot drill, clockwise direction, few millimeter, and that's it. After that, I will use as last drill 2.3, but I will change the direction. Have a look. Counterclockwise direction, high speed and huge irrigation. Counterclockwise direction, and with this drill I can touch the sinus membrane. Okay? Exactly like this. After that, I will use as the last drill 3.3. Always in counterclockwise. Okay? Have a look. Obviously, I need to check the parallelism between the implant, as usual, is very important for the prosthetic reason. Only after that, we can go ahead with the next and the last drill. 3.3 counterclockwise direction, and I can enter in the sinus within 3 millimeters, exactly like this. Have a look. Counterclockwise, 3.3, 3 millimeters inside the sinus. Pumping movement, high speed, and huge irrigation. Okay? After that, in order to increase, now I want to, this is the same drill, but now I want to show better when I was in the sinus, pumping movement. Okay? Always high speed, and now I am in the sinus. I can check with the probe. The same drill, 3.3. And now you can see we are in the sinus. Okay? Only after that I will use the bone grafting material, the dentin bone. Now I'm starting to use this interesting bone material, the dentin, harvested from the teeth of pig. And then I will use the last drill, 3.3, counterclockwise direction, low speed, quindi low speed, without irrigation, slowly, low speed, without irrigation, in order to increase the sinus membrane, step by step, slowly, with the low speed. Again. The same thing. Now, counterclockwise direction, 3.3 drills, like this. Low speed, increasing slowly the sinus membrane. And here I used the 4.2 and 11.5 as a final implant. Okay? And now we can check. And I want to show another interesting procedure. treating the implant surface with the UV machine in order to increase the bone healing, in order to reduce the healing time, and in order to increase the hydrophilicity of this kind of implant surface. So we can treat the implant with the UV machine for 15 seconds, exactly like this. Only a few seconds. This is the UV treatment. This is a new interesting protocol that I use actually. Only a few seconds, and then we can place the implant. And it's very interesting to see the reaction of the blood on the implant surface. This is amazing. Have a look now. Have a look at the implant surface after UV treatment. Have a look now at the blood. Just to touching the blood. This is amazing. This is a very, very, very interesting approach. And then we can place the implant. And have a look also the primary stability. More than 35 Newton. And then we can finish with the manual ratchet. Like this. And evaluate the CBCT after the sinus elevation. Okay? Only with the crystal approach. So this is an interesting case. And if you want, you can scan this code, and if you scan with your phone this code, you can have this protocol, these bands on your phone. So please, if you want, you can scan this code with your phone, and you can have this animation on your phone. So using this approach, we can treat many cases. Another case like this, in which we have only a few millimeters of residual bone height and we have a chronic sinusitis, but we have a good thickness of the bone. So how we can treat? Using the same approach. I use always the prosthetic guide to place correctly the implant. So we can start the implant site preparation exactly like this. This is the flap, the thickness of the bone is enough. And the implant site preparation using the osseodensification bands. And through the cavity, it's possible to see the blue line and the sinus membrane. In this case, I use 5 diameter per 8 of length. Healing cap as usual, and have a look at the CBCT post-op. This is the crystal sinus lift using the crystal approach and using the osseodensification in only one step. So, starting with 4 millimeter, and then we can place 8 millimeter, increasing the bone height about 4 millimeter using this approach and using the same procedure. Okay? And then after only 3 months, we have this healing. So we can deliver the temporary crown and after the final skewered crown with a good result and a good integration also of the soft tissue. Only one step, only one surgery. But have a look through this plastic model how we can use this drill. So as I told before, for example, in case we have 4 millimeter below the sinus cavity, we can use as a first drill this pilot drill 1 millimeter below the sinus membrane in clockwise direction. And this is the second drill, 2.0, according to the diameter of the implant, but just for example, and 3.0, just to see through the model how we can use these drills. So as I told before, in this case, we have at least 3-4 millimeter below the sinus membrane. So I will start with the first drill in clockwise direction to prepare the cortical site. Exactly like this. Okay, first drill. Clockwise direction, high speed, and huge irrigation. Okay, only a few millimeters. Okay. And then we can go ahead with the next drill 2.0, counterclockwise direction, only touching the sinus membrane. Have a look at the direction, counterclockwise. Touching only the membrane. Then with the last drill 3.0 that I used in this example, I can enter in the sinus within 3 millimeters. And then now we can see the sinus membrane elevation. 3.0 counterclockwise. Have a look now. Have a look at the sinus membrane elevation now, without perforation. Okay? This is the same that we can see on the patient. Again, have a look. Without perforation. It's possible to see through the membrane the bands without any perforation. And now we can check the integrity of the sinus membrane. Have a look. Okay. So basically, this is the protocol that we need to use. And have a look at this intraoperatory view. We are in the sinus cavity with the endoscopic view. And now with this endoscopic view, it's possible to see into the sinus, the bones that we have used for this procedure without any perforation through the membrane, maintaining the integrity of the membrane, using in counterclockwise direction. This is an amazing procedure. And as I told before, we can use also in very extreme case in which we have only 2 millimeters of residual bone, but we need to have at least 6 millimeters of bone thickness. But anyway, have a look at this amazing image. It's possible to see through the bone the sinus membrane in the both sides, maintaining and preserving the sinus, the integrity of the sinus membrane. This is an amazing result using these parts. And sometimes we need to treat a case like this, in which we have this situation, only few millimeters, these hopeless residual dental elements. So we need to treat and we need to remove this dental element. This is the occlusal view. So I removed both elements and I prepared using the palatal approach. As you know, in immediate implant placement, we need to place the implant a little bit palatal. But anyway, it's very interesting to see the implant site preparation and the sinus membrane elevation and the bone septum expansion using these bands. Have a look at this image. This is amazing. This is the bone septum expansion in the molar area using the densa bands and the sinus elevation in only one step, in the both sides. This is the new cavity inside the alveolar cavity, and this is the bone expansion performed by the bands and the sinus elevation at the same time. And I placed 2 implants. And obviously, after the implant placement, I filled this residual gap with the bovine bone. And it's very interesting, as you can see, and it's very interesting to see the CBCT post-op. In the premolar area, I increased the bone eye exactly like this. This is the sinus membrane and the implant. And this is the situation in the molar area. Double sinus augmentation in only one step, in only one surgery with minimal invasive procedure and very minimal flap. So sometimes we need to place the medial implant in the molar area. And how we can do? We are in the upper jaw. We have this hopeless molar in which we have the fracture of the molar, so we need to remove. Using the piezo approach, I can remove this molar with a traumatic approach, and then we need to plan to place the implant in the middle, not in the palatal root, but in the middle. So we can use, this is the X-ray before, so we can use this approach, the first drill in clockwise direction. Now we can change using the next drill in counterclockwise direction to prepare the implant site. Exactly like this. Have a look. Counterclockwise direction, high speed, huge irrigation, and then the implant placement with high torque insertion. Like this. Have a look. The bone septum expansion, it's possible to see through the cavity the sinus membrane, and then we can place correctly the implant in the middle of the residual alveolar cavity. Exactly like this. This is the procedure step by step. Atraumatic extraction, osseodensification procedure, immediate implant placement, sinus elevation, bone grafting material around the implant to preserve the bone. And then we can see the healing only 3 months later, and then the final screwed crown in only one surgery. Another case, always upper jaw, in which we have this situation and this situation, few millimeters below the sinus. So I want to increase the sinus, and I want to expand the bone using the same procedure, exactly like this. Have a look, the implant set preparation using the osseodensification balance. This is an amazing result and the same approach, and then we can place the implant. But have a look at this short video about this case. So, small flap without vertical incision, 3.5 millimeter of residual bone. Okay. In this case, I use directly the second drill, 2.3, in counterclockwise direction because I have only 3.5 millimeters. So I prefer to avoid the pilot drill, but I will start directly with the second drill, 2.3, counterclockwise direction, 1 millimeter below the sinus, and then the last drill, 3.3, counterclockwise direction. And with this drill, I can enter in the sinus within 3 millimeters, according to the protocol, using this pumping movement, moving the bone. Okay? And now we can put inside the dent in the bone, and I will use the last drill, 3.3, counterclockwise direction, low speed, without irrigation, to increase slowly the sinus membrane, step by step, like this, dentin graft, and then we can put inside slowly, low speed, without irrigation, the bone. And then we can place the implant, 8 millimeter of length, so I increase it about 5 millimeters. High torque, as usual, and only 2 drills. The X-ray post-op and the CBCT. Evaluate the CBCT, the bone that I used to increase the bone height, like this, the integrity of the membrane. And then the sutures. So we can wait 3 months. Again, the CBCT is very interesting to see the result of the CBCT. And this is the healing 3 months later. We have a new soft tissue shape also in comparison with the situation before the surgery. Temporary, and then the final crown, final screwed crown with a good soft tissue result. Another interesting case, molar area, in which we can prepare the bone septum exactly like this. But have a look at this amazing image. Bone expansion, and it's possible to see through the cavity, the sinus membrane, and the integrity of the sinus membrane. So in only one surgery, we can remove the molar, we can increase the bone height, we can place the implant in the center of the crest. Same protocol, healing cap, secondary closure using only the collagen exactly like this, and this is the healing only 3 months later, only 3 months later. And then before the temporary, and then the final screwed crown, exactly like this. Good result and good stability. And I want to share this case. This is a very interesting case. As you can see, we have these hopeless residual dental elements and a few millimeters of residual bone in the posterior. So in this case, I treated the anterior with the normal drills and the posterior with the denser part. Have a look. using this conical implant, so 2 millimeter, placing the implant 2 millimeter below the bone. This is the atraumatic extraction. For sure, the atraumatic extraction is mandatory. Also, is important to clean accurately the residual cavity, exactly like this. Obviously, the patient is under antibiotic therapy. So in the premolar area, in which we have enough bone, I used the normal drills and I prepared this site using the right protocol, placing the implant a little bit palatal, placing in the both sides 4.2 and 11.5. This is the implant, 4.2 and 11.5 with high primary stability in the anterior side, using the normal drills. Checking the correct balance. Now we can go in the posterior. In the posterior, we haven't the bone septum. So we need to reach the stability on the palatal side. Using directly the second drill, 2.3, counterclockwise direction on the palatal bone side. Okay? And then the 3.3 in the same counterclockwise direction, high speed and huge irrigation, entering in the sinus within 3 millimeters. And in this case, I put inside only collagen without bone. So I used the bone that I recovered during the osseodensification for the sinus elevation. And then I can place the implant. High primary stability. Have a look. 4.2 and 11.5. Good primary stability, the occlusal view. And as usual, I use the heterolog bone to fill the gap between the implant and the residual bone, exactly like this. Secondary closure, covering only using the collagen. And now we need to wait 3 months. This is the X-ray post-op. And now we can wait. This is the healing 3 months later, the second stage using the healing cap, the impression, the digital impression for the temporary restoration. Have a look at the correct parallels that we can see. This is the temporary crown. It's very important to have the temporary crown to manage the soft tissue exactly like this. This is the temporary restoration. The healing with the temporary restoration, and have a look at the situation 2 months later. An amazing result in terms of the soft tissue management and soft tissue shape. Then after 2 months, we can take the impression for the final restoration and for the final screwed bridge. This is the details about the final screwed bridge, and this is the situation before, after implant placement, the final healing, and the final restoration, and then the final result. But now I want to share the X-ray result. This is the OPG, but it's very interesting to see the new bone that we can see in the posterior side that I treated with osseodensification without grafting material, using only the autologous bone recovered using the osseodensification. This is an amazing result. And sometimes we have a very challenging case like this, in which we have this molar only a few millimeters below the sinus cavity. So we need to treat and we need to remove this molar. So after the extraction, we have this clinical view. And as I told before, I want to place the implant here in the middle. So I want to prepare the bone septum using these bands. And this is an amazing view because it's possible to see through this site the sinus membrane. Then we can place the implant. Obviously, I need to put inside the bone to increase the sinus membrane, like this, secondary closure, but it's very interesting to see the CBCT post-op. This is the sinus augmentation performed by the crystal approach, like this, using the osseodensification and using the heterolog bone. Only one step. And I can wait only 3 months, and after 3 months later, we have this healing. So I can take the impression for the temporary crown, and I can deliver this temporary restoration. Okay? And now we can wait 2 months, 3 months before the final restoration. And this is the stability at the time of the temporal restoration, the stability of the bone, only after 3 months. And this is the last and very interesting case, few millimeter again, and I want to share this small video. Also in this case, I didn't use the grafting material. I used only the osseodensification, putting inside the cavity only the collagen. Also in this case, I decided to start directly with the second drill, 2.3, in the counterclockwise direction with the pumping movement, exactly like this. And then the 3.3 entering in the sinus within 3 millimeters. But don't forget, we need to follow this pumping movement. This is only collagen that I put inside without bone. And then the implant. 4.2. And 10, I think. I remember. Okay, now we can wait. This is the X-ray post-op. This is the implant. And have a look the situation 4 months later. 4 months later, we can see the new bone above the implant. The bone recovered using the osseodensification, only collagen without grafting material. This is the healing using the temporal restoration. This is the final screwed crown. And this is the final X-ray. So with the osseodensification, we need to remember this concept. We need to avoid the osseodensification in the surgical site in which we have performed the bone regeneration. Regarding the bone expansion, for example, sometimes if we have only few millimeters of residual bone, it's better to cover the buccal side with the grafting material. And in terms of the under preparation in the maxilla, we need to prepare from 0.5 millimeter and 0.7 millimeter less than the implant diameter, and in the mandible only 0.2 and 0.3 millimeter less the implant diameter. So don't forget this concept using this protocol. And if you want, you can find some publication and some article about this procedure. So thank you for your kind attention. I hope everything was clear. And if you have any question, please feel free. I'm here to answer your doubts and your questions. Thanks again.
Vous êtes à la recherche de la meilleure formation professionnelle en matière de santé? Des cours en ligne ou en présentiel, des ateliers pratiques, des conférences, des congrès, mais aussi des symposiums, des webinaires et bien plus encore. BK Med Events est la meilleure plateforme de connexion entre les professionnels de la santé et les acteurs de la formation continue. Sur la plateforme en ligne de BK Med Events, vous allez retrouver tout ce qu'il vous faut. Des prestataires du monde entier réunis en un seul endroit. Et si vous êtes des prestataires de la formation continue, nous avons une bonne nouvelle pour vous aussi. Juste restez focalisés sur votre programme scientifique et BK Med Events se charge du reste. De l'inscription des professionnels de la santé à la remise des attestations, en passant par une campagne de communication professionnelle pour mettre en valeur vos projets.
Okay, thanks again.
Hello, once again, dear colleagues. I would like to pass on the apologies of Dr. John Mark. He had to leave us due to last-minute commitments. So I would like to thank you, Professor Angello, for this rich presentation, for your generosity and for your sense of sharing. We will now move on to the question and answer section. So we start by the first question. What is the minimum bone height that allows bone densification and the implant in the same session?
So you can place the implant in the same time. Also, if you have only 2 millimeters of residual bone height, but you need to have at least 6 millimeters of thickness in terms of the horizontal direction.
Perfect. What is the next question? So, which biomaterial do you prefer to push back the sinus membrane and promote bone formation?
So, as I showed before, sometimes if we have enough bone, like 4 millimeters, for example, we can avoid the use of the grafting material using the autologous bone that we can find inside the implant site preparation. Otherwise, if I need to use the grafting material, actually I use bovine bone, but actually I'm using the new intestine material. This is the dentin harvested from the teeth of pigs. It's a very interesting product.
Perfect.
Dentin graft.
Perfect. So the third question is how to check that the sinus membrane is not perforated during the preparation of the bone.
So for sure, according to the experience, if you have some perforation, sometimes in this kind of preparation, you can see directly the membrane, and you can see the hole, you can see the perforation, or sometimes you can invite the patient to do the Valsalva test,
Yeah.
and we can check the integrity of the membrane.
Perfect. So the next question is, do you immediately place the healing abatement, or are there cases where do you use just a two-stage surgical technique?
It's an interesting question. When it's possible, according to the stability of the implant, the quality of the bone, and according to the patient, if we have a smoker patient or not, if we have a healthy patient or not, if we have a patient with diabetes or some disease, I prefer to cover. But if it's possible, I prefer to place at the same time the healing cap. Why? because I can manage immediately the soft tissue and I can keep the soft tissue bone.
Perfect. So I think that's all what we got as questions. And I'm going to thank you again, my dear professor. Once again, thank you for this rich and simplified intervention and also for your generosity. I hope, inshallah, that we will meet again very soon on this Tawassul platform to discuss another topic as interesting as this one. And before concluding, I would like to thank you, dear Tawassulians, for the interest you have shown in our Ramadanese series of webinars, my dear professors for their scientific interventions and their sense of sharing, our sponsors and partners, and of course, I would also like to thank my dear friends, the administrators and moderators of the Tawassul platform for their commitment to serving the members of this amazing and successful group. And last but not least, I wish you all Eid Mubarak Said. Thank you.
Bye-bye.
Bye-bye.